Got a lot of great questions already coming in. Thank you for them. You're watching your legislators along the network of the Minnesota Public Television Association. The phone number is 800-726-3178. And I've got one here. Maybe Senator Benson's health care might want to start it out. Maybe from Canby. Lori asks, and this is, I don't know this, but I think you will know what she's talking about. Please explain the reason no funding was included for the staffing crisis in home and community-based waivers.
Home and community-based services are scheduled to get an increase based on the Bureau of Labor Statistics, a federal standard for wages. So they're slated to get an increase. That money's built into the forecast. We didn't add money because that money is already in the forecast.
Okay. Anybody else want to jump in on that?
11%.
11%.
Oh, so it is.
It's significant.
The reason it didn't get funded is because the Republicans wanted all the money to go to the biggest companies and the wealthiest individuals in the form of tax giveaways.
I don't think you understand what the question was. The question was, why wasn't there funding? It's built into the forecast. The legislature had authorized a 7% increase, plus there was a provision that said whenever the Bureau of Labor Statistics adjusted wages, they would get an automatic wage increase. So it was already built into the forecast. So they were getting an 11% increase.
Well, I'm talking about the 5% campaign, and just by what you say, I'd like to see anyone out there who works in the home care industry see what you're making now and see what you're making next year and the next year, and there's not going to be any substantial difference because working people, you mentioned earlier that this session was a success. It was a success for certain people. For everyday working people trying to make a living and support a family, we're really left behind by this session, and I assume we'll get more into that in future questions, but it's been very disappointing just for ordinary people trying to do their best to put food on the table and afford health care and child care and be able to send their kid to school and retire with $1 in their pocket. Those are the people who got left behind, and at the expense of well, really in favor rather of big tobacco and estate taxes. I mean, that's where the money went, and it's sickening.
Just to clarify, the tax bill did include tax credits for student loan debt.
I wrote that bill, so I know that it was in there.
Social Security tax relief and child care tax relief. And so everybody you talked about got something in the tax bill.
Senator Hoffman,
John's bringing up a valid point because there are some concerns, and we should ask the question too, and there are some concerns regarding the tax bill. Was it, what did we do for our future legislators? What did we do knowing that in a year some of this money, it's not just one-time money in that tax bill, it's ongoing obligations. There's another obligation there, $400 million coming out of, in the transportation side, coming out of general fund. But John's raising a couple of points that I think are important to consider here. There's about 1,200 families that will really benefit from that wealthy tax. I'm not in that wealthy tax thing, but there's 1,200 families that would, and the last time I looked at that, that's really where the benefit comes to. But the woman from Canby is on a very good point. In western Minnesota, there are group homes closing because they cannot they cannot compete on the hourly rate that anybody else is out there. And I know that to be fact. And anecdotally, I know of 5 specifically in western Minnesota that did shut their doors, and the people that were in the home and community-based services all of a sudden had to go back to their families or had no place to go. That's a systems problem. The piece you guys are talking about on the Department of Labor and doing that, the forecast, that actually was my bill in 2013, 2014 that put into the forecast for 2017. And there's debate still on the management and budget side. Either it's 4%, 7%, 11%, and some argue that it's 18%. But that was set aside in order to assure that was in the forecast. And the thing that you're valid on is that people that are working within folks with disabilities aren't being paid what they should be getting paid doing that, and there is a problem with that, and I absolutely understand and hear the person from Canby that they're not paid the way they should be paid.
I think the concerns that we heard also need to be expressed in terms of what's happening at the federal level. And we've got, I used the analogy this morning. I was in Rochester and we were talking about health care down there, obviously with Mayo. But we as a state have to figure out where the puck, using a hockey analogy, where the puck is going to go as opposed to where it is. And right now, if you're skating on the ice, there's so much fog on the ice that you really don't have a good sense. So our mandate, candidly, is to make sure that the people that are most vulnerable amongst us are supported and taken care of. And until we see that fog lift and we can get our arms around what types of opportunities the state has based upon what they do with Medicaid and Medicare, what they do with the reform of the ACA, I think we're at a bit of a flux in terms of, you know, making decisions. Now, that being said, the concern that I have is that and John, to your point, I would say you're sincere. I would say you're sincerely wrong in some respects because of what really is in the bill. But, you know, when you're talking about health care, we're going to have some really pointed and hard conversations with people that really not right now are in support of what we're doing, because no one's going to come out of this unscathed. And we are going to have to reevaluate the whole healthcare model. And it's not going to make anyone happy, and it's not going to make, no one is going to be protected from that conversation. And that's going to be a very difficult dilemma. And it is going to call for strong bipartisan support. It is going to call for statesmen to rise above the rhetoric. And I look to the campaign of 2018 for the gubernatorial candidate to see if the cream rises to the bottom, to the top of the can in terms of leadership on this very important issue.
And to that point, Eric, you know, we did, Senator Abler, Senator Ralph, there was a few, we had done these, a working group, and Senator Benson, you know, said, you know, yeah, run with it. And it was specifically dealing with the HCBS services on the day training programs because, you know, on one hand, the Centers for Medicaid Services tell us we have to operate a certain way. And we've been trying to bide enough time because when I was elected in 2013, Centers for Medicaid Services told our Department of Human Services, you need to make these changes January 1st of 2014.
Right. Yeah.
It would have literally put 36,000 people that are most vulnerable in the state out without any kind of services supports.
Yeah.
And at the time, Abler and Newton were in the House. I was in the Senate, and then Kim Norton was part of that. Julie Rosen was part of that discussion, and we had bought this 5-year plan. Now we've added another 2 years just because we know real systems change, and that human services takes 10 years. Another point that you bring up that scares me is adding to what you're talking about, not knowing what the feds are going to do, the fog that's coming there, right? If you look at the budget of our president, $850 billion over an X period of time is a pretty doggone scary thing because then all that comes back to the states. You states figure it out. In Minnesota, we're going to have for the first time in history more people in retirement than we are in our K-12 system. And that's going to happen in 2020. Right now, 635,000 people in retirement. In 2020, that's going to go to 965,000 people. This is 65 and older. The hit, and I said this the other morning, is right now the medical assistance need out of our general fund is 1.1 or 1.2 billion. 7 years from now, it's going to be $3.5 billion. So all of a sudden, you triple that. So not knowing the fog, not having that, I agree we should have some work session, not just work sessions, but working groups that say, what's the best way that we're going to do this? Because the silver tsunami isn't coming. It's absolutely here. So
baby boomers redefined the way that they lived in their working years. Baby boomers are absolutely going to redefine how it means to live and to live well on their own terms in retirement. And even further than that, what is the value of those final years? And I think that gets to the health care question in a very, very large way. If you take a look at the expenditures that an individual lays out in the last 60 to 90 days or 6 months of their life, I think some very, very intuitive questions need to be asked in terms of who are we providing opportunity for? Is it the hospital and the pharmaceutical company, or are we putting patient and individual at the center and letting them decide what that value of life is all about? So I think that's a long-term perspective that we have to take.
But the silver tsunami, Representative Applebaum, I guess that's...
He's not there yet.
It's not there yet.
Not there yet.
Not there
No.
yet.
Don't
But,
use
No, I'm there.
But that's a big issue.
Tony, you're a baby boomer, right?
I'm a baby boomer.
Of course, it's a big issue. I mean, healthcare is the second largest budget item that we have.
Absolutely.
And especially with the uncertainty at the federal level, I think we should exercise a little bit more caution than we demonstrated this past session. And this is a cynical opinion, but I think it's a fact that the legislature revolves around money. Our job is to pass a budget. Everyone that comes to meet with us, 99% of the people who come to all of our offices, they want money for their organization, for their program, whatever. So there's only so much money. Our job is to spend, and it's money that everyone watching this show pays for every time they buy something, every time they get a paycheck. It's taxpayer money. We should be spending the taxpayer money as wisely as possible and investing in ways to improve government services, not by giving the majority of it to health insurance companies with absolutely zero assurance that rates are going to go down, like was what happened with the reinsurance bill. So by focusing on employees rather than employers and doing more to drive down the cost of health care instead of just, oh, here you go, big insurance company, we'll just take your word for it that our rates are going to go down, and oh, hospitals, you guys aren't making enough money, here you go. We need to do more about driving down the costs and protecting people that deliver our services so they can do a better job and keep people healthy, which will save everyone money.